It's important to point out that the first 2 years are transitionary years. So 12, 13 and 13, 14 are years in which the Commonwealth funding to jurisdictions, to states in your case, is guaranteed for a period of 2 years at the level that's described in the old 2008 agreement. So that's a fairly tortuous sentence, but in actual fact what it means is the old funding that was agreed in 2008 is guaranteed to the state for another 2 years. There's some factors around how it grows, but I won't bother you with that today. So there is some protection for the state in the introduction of activity-based funding. That protection does not necessarily extend down to local hospital network level, but it does extend to the states. From 2014-15 onwards, the Commonwealth will be required to pay a defined percentage of growth, but it'll be an open-ended system. So if there is less activity done in a jurisdiction after 14-15, and there are, I can think of 2 jurisdictions that are planning, not this one, are planning to do less work in 2014-15 and beyond than they're currently doing. They will be paid less from the Commonwealth from 2014-15 onwards. Alternatively, more likely, jurisdictions that do more work from 2014-15 onwards will be paid a proportionate increase by the Commonwealth, and particularly in terms of the growth of expenditure. So, to oversimplify matters, in the first 2 years, relatively protected state-level guarantee, if you like, and from 14-15 onwards, a more open-ended activity-based funding system.